We have built a medical system for the varicose veins clinic to generate a treatment plan text. Here you see the login screen for the system. So here we will see the top sections. So the it contains 4 steps process to generate the treatment plan text and the final step treatment plan. So we have chief complaint, physical exam, venous mapping. So for each patient on the left side, when we click on the new patient, we will have this kind of screens you can see here on the right side. So for all these, in every patient we will have this kind of fields: age, weight, history, signs of disease. On the bottom we can have the text generates based on these input fields we select. So we have science, history, and stockings for the person. If we select in a where the person uses stockings, so you have used 3 months or 6 months or 1 year. So for example, here we select the number of years. If the person is suffering, we able to provide here in the last section number of years with a problem. Based on this text generates. For example, let us assume age is 18 and the weight is overweight, and history science if the person suffering from the diabetes and high blood pressure. And you can see here on the chief complaint, the text automatically generates based on the histories, and age will be updated on selection. So if the person use stockings, if we select 3 months, the chief complaint will be automatically updates the stocking is equal to 3 months. The next screen is a physical exam. Here on the right and left we will have different medical conditions for the patients. For the right and left leg, here you see front and medial and lateral and back and cough. So based on these physical exam generates, on the bottom we have the different parameters VCSS and clip score for the right and left leg also. So on the right, if we select front or medial varicose veins, 2 AS, and lateral also if it selects AS, and the left the parameters also available. So and the lateral and the left side also if we are selecting yes, and back of varicose veins if it is AS, and person suffering from the edema also. On the left leg we can have parameters of the person, dark skin is equal to apply to angular cough, and if it's ulcer we can select yes, and stage of the ulcer we able to select also here. So based on this physical exam with all parameters selected on the top displays automatically. Let us use here and the right varicose vein distributions, GSV, AAGSV and SSV. So these are selected, these are generated based on the fields given on the screen. And now you see the ulcer from for the left leg also displayed here under the skin section. This is whole text is for the purpose of generating the physical exam. And now we will see the third step where we will provide the parameters for the venous mapping. So on the top you will able to see all kind of warning messages, because we have selected parameters in the physical exam, so that we don't need to we do give the minimum values and the venous mapping, so that it helps in the it going to generate in the treatment plan. So perforators for the right and left sections are available. So right and left deep system. superficial system CFE. For example, if we give 1000, we have the drop down selection for the CFE. So these are all the input fields. If at all, we can give the mappings parameters in the venous mapping and the perforator sections. So below in the venous mapping, the text will be generated in the format of two columns for the right and left leg. On the selection only, the venous mapping going to update right here in the text area. So on the next screen, we have the treatment plan. So this is the final steps. Here we provided different insurances available, and based on the insurance parameters, the total text along with the treatment plan will be generated. And now you see the total text here in the text area. In the bottom you can see the medical treatment required for this patient for the insurance selected if it is opted for. So these are the insurance drop downs that we can configure through the admin section. So because all these insurance parameters, we can give the minimum sizes for the GSV, SSV, and tributary and perforators, so that the medical treatment codes automatically generates. So now the whole text can be printed through a Word document that you can easily use it as a report section. The whole text from the chief complaint to venous mapping, physical exam, and the treatment plan will be pasted in the Word document that can be used for the reporting generation purpose. This is the whole system for the venous mapping system. Now we'll see all these insurance parameters. How can we all the perforators, all these input fields based on this treatment going to generate. So now we'll see the admin section where we can configure the new insurance plans or existing insurances. How can we modify the minimum sizes for? Here you will see the user section, also insurance guidelines in the user section, and insurance guidelines you see in the drop down already given for the Magna Care. And if we just go through any insurance parameters, let us say Fidelis, here you will see all the minimum sizes provided. Based on this minimum sizes for all these attributes, the treatment plan generates on the screen of the treatment plan. So if X-ray allowed for, so new insurance can be added in this section also. So Viritana X-ray also can be set through this section, whether the is allowed or yes or no. So for each user also, not only the admin but a user can also configure the same insurance plans from the user interfaces through their username and password given, which can be added here. So for each user we have username and password, so they can be also modify these parameters. So these are all the minimum sizes and accessory in Veritana and logout. This is the whole system all about Verica's venous section to generate the text and the treatment plan. Hope if you have the same kind of requirements, please post the message to my mail ID or talk to me. Thank you. Thank you so much.